Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin Neither. The world of technology and healthcare are ever-changing in new or novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we'll be asking each other 4 random health IT questions. Be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 16 years of health IT blog content at healthcareittoday.com. You ready for some surprises, Colin?
Yeah, well, first of all, the surprise for anyone watching this is that you and I are actually in the same room recording this for the first time.
Yeah, so if the audio is different, you'll know why, but it's kind of fun to be together. Like, it's a different energy, I think.
For sure. For one, I think we're going to be talking over each other for a little more often than we do via Zoom.
That's actually true, huh? I mean, and it's interesting because Omicron is, blowing up, and yet we're actually together, which is pretty awesome.
It is pretty awesome. Yes. Hopefully this will become more of a thing next year.
Yeah, absolutely. So let's hear, what's your first question for me?
My first question for you, John, in 2022, what is going to screw up healthcare the most other than Omicron or COVID?
COVID? Oh, what's going to screw up? I think the thing that's going to screw up healthcare the most is going to be telehealth regulation, reimbursement, just all of that, because we've seen how powerful telehealth is for the patient. But I think that we're not going to reimburse it the way we should. There's going to be the licensing issues across states. That's still going to be a problem. Maybe they'll allow phone. Like, that's my only kind of like partial hope, is they'll say, okay, yeah, the phone call can still be reimbursed the way it was during COVID. So I think that it's going to be an utter policy disaster in telehealth. So that's my prediction there.
Interesting. I have to agree with you. I think that definitely, we're heading to the trough of telehealth again. After all of the hype around it last year. So yeah, it'll be interesting if the government screws it up with some reimbursement shenanigans.
Yeah, but what's fascinating is like telehealth growth blew up to like 60% during COVID, and now it's coming down to something more reasonable, but it's still like an order of magnitude larger than it was previous.
Sure.
So it's not a bad thing that, where we're at, but the legislation is going to be a problem. So, well, I have a different one for you. So if you could change one thing about healthcare IT, what would you change?
Oh man, if I could change one thing about healthcare IT, what would you know what I would change? I would change the expectations of funders. I would go that route. The reason I say that is because I think the money that's coming into healthcare right now has an unrealistic expectation of when they're going to get back that money and what the multiples are. And so they're putting undue pressure on companies that actually have really good products and actually will help, but they're trying to drive them to achieve revenue targets and growth goals that are just not practical in healthcare. So if I was to change one thing, because I've met a lot of companies and a lot of entrepreneurs who have fantastic ideas and really good business models, but you just look, being industry insiders, we know, like, man, that's going to take like 5 years for it to really get going.
Yeah.
And you're going to need a few pilots. You're going to need a few like avatar customers or exemplar customers. But I think the pressure that they're under is to produce results in like year 2 or year 1, right? And I'm just going, that is not possible for the most part in healthcare. So one of the things I would change definitely is the expectations of funders to give these companies the runway they really need, because healthcare just moves slowly. Right. And then when you get slammed by like COVID, or you get slammed by just reimbursement changes, all of a sudden your world can change. And I don't think the money really understands that. And I think some of them do. Some investors understand healthcare, but a lot of them don't really understand it. So that's one thing I would definitely change, just to spur more innovation so that we have one of these small companies out there.
Yeah. There's some healthcare investors that understand it, but there's so many that don't. And exponential in healthcare is a hard thing, and it's usually a bad thing. So I think I get you. I would have taken employers out of healthcare and made it all a nonprofit. Like a true nonprofit, not the fake nonprofits that we have in healthcare today, because it creates the wrong incentives. I think that's the problem.
Yeah, that's a good one too, obviously. But of course, that brings you closer to the Canadian system. I don't know if you like that, John. Like that's.
Well, I mean, when I hear you talk about your visits to the doctor, I kind of like it.
Oh man. And by the way, for everyone listening and watching this, these questions, John and I did not tell each other these questions ahead of time. So that's why we're kind of
Surprised.
we're a little bit surprised, but you'll hear some awkward pauses, I think. Oh man. So what's your next question for me, John?
Yeah. So if you are looking, of course, you want to work at healthcare scene because it's the best company in the world. But if you couldn't, right, or didn't have that anymore, what 3 companies would you like to work at? What 3 health IT companies would you love to go and work at, and why?
Oh man, you're really putting me on the spot. Okay, what 3 health IT companies would I want to go work at?
By the way, this is not a message for those companies to come recruit you.
Okay.
That's,
It's just okay.
We want you here.
Okay. All right. Thank you, John. Wow, you're asking me to play favorites here. I'm going to upset a lot of people, I think, with this answer. Yeah. Okay, so I got to say, number 1, I would have to say I would kind of be intrigued to work at Redox. And for 2 reasons. One, I mean, I know of them pretty well, and Nico and Luca are awesome. I think they, have a really good culture at the company. So I think that's attractive. I think also just because they get a chance to work with so many entrepreneurial companies and work with them and sort of bring them into the fold of healthcare, I think that's pretty cool too. And then lastly, of course, their offices are in cool places, right? They got one in Colorado, and then Denver's pretty nice, and we can't compare to the taco parties that they throw, right? When we had
so them. The tacos sold you, is that?
So really, I was really gonna say it's really the taco party that
note to self: hold taco party.
Oh, taco parties. Keep going. so that's one. I definitely have to say I would that would be a lot of fun to be at. The other one I would say that would be fun is it's gonna sound funny. Is I would actually be very interested to work at Epic.
That would be.
And I say that because I've never actually been to the campus, so that would be kind of fun, right? Like just the tree house and all that kind of stuff in Madison. I mean, it'd just be fun. The second thing, I'm just so intrigued by what it's like inside that company.
Yeah,
because it is a black hole. Like I don't really talk to a lot of Epic people to see like what's it like inside, and I've heard rumors of good and bad working at the company. So I'm just more curious. I think it'll be fun. And whether we like it or not, Epic is at the center of a lot of conversation and a lot of what's happening in healthcare. Right. And so to work at a company like that, of course, I'm in marketing, so I don't think I'd actually get hired there.
Well, you'd be the first marketing person at Epic. I mean, that would be a pretty awesome. In fact, you're the right person for that type of position, which is fascinating.
That's a plug, by the way. No, I'm kidding. that would be So I probably wouldn't end up there, but it'd be just intriguing, right? Like it's just an intriguing company. They're well positioned, obviously. I don't think anyone's talking about them being bought or anything, so they're going to remain independent for a while. So I think there's something about that. So that's the second one.
It reminds me of when I was interviewing for jobs before I got into healthcare, actually. And I interviewed for this tech position for some committees and senators in DC. And the thing that intrigued me most about the job was I want to see what it's really like in DC. Like, is it corrupt as I think it might be, or is it not, right? Like, so it's kind of like, what is Epic really like? That's intriguing.
Yeah, it is. And if I had to pick a third company to work at, and this is going to be a weird one, I would actually pick I would oh, this is so tough, John. I'm like, I got 3 in my head.
I was going to say there's like 40 you can choose.
Right. But I would actually say I would pick the Barrel Institute. I would pick to work for the Barrel Institute. I think that, first of all, I think their patient experience conference is amazing. I think some of the research they put out is incredible. The people there that I know are just phenomenal. Jason is a fantastic leader, a fantastic person. And I just think that what they do, right, the promotion of patient experience, helping people in that space be better at what they're, sharing tips and tricks and strategies. And those would be the 3. I just admire what they're doing.
No, I mean, a great group, and you'd be a good fit. I mean, their mission and vision is kind of what you like too. So
That's a good question. So now I have to remember this question to ask you the next time I'm going to do a random question thing. Because now I'm curious to see what yours would be.
You notice I haven't answered.
Yeah, you're not volunteering any either, right? You're not pissing off people who are watching this. That's what you're doing.
Well, I mean, at the end of the day, it's kind of more, in a lot of ways, it's your preference. It's what interests you, right? So, I mean, but it's also what companies are exciting and what organizations are exciting and doing interesting things, making an impact, right?
Right. So here's my question, which is somewhat related to this. It's funny we actually choose the same questions, similar questions. So my question is, what are the 3 companies that are going to make the biggest impact on patients in 2022?
Oh, on patients. That's interesting. So if I look at the impact on patients, well, and companies is harder. I wish you would have said, categories. Categories would have. So I mean, I guess I'd choose the leader in that category. Maybe is that. I'm trying to think through, because I mean, I would say the biggest impact is probably going to be the patient engagement companies, the whole digital front door companies. So I would lead with that one maybe first, right, as a category that's really going to make a change for patients for the good. And so if I were trying to say who's going to be the leader in that, it's hard to argue with Well Health. I think they're doing some incredible stuff, right? So I think, they have a broad footprint, they have impact. Though Innovacir is, or Innovacir, I've never known which way you pronounce that, but that company is, I mean, they just got a $3.2 billion valuation.
That's right.
And they actually have a broader picture. So maybe one of those 2. In fact, maybe I'll just do 2. See, then I cheated there.
Yeah.
2 for 1.
2 for 1.
But then, I think the other one that is going to be interesting is a company that you probably wouldn't have expected, that I think is going to have a dramatic impact on patients, is actually Nvidia.
Really?
Yeah.
Okay.
Nvidia. And now here's why Nvidia is so interesting for patients, is because they're going to power the AI of almost every other health IT company.
Okay. True.
So the Nvidia GPUs and everything that they're doing as far as, being able to do AI in the cloud and things like that, that's going to transform hundreds of health IT companies. That's then going to impact the patients in a massive way. I mean, we saw that during COVID. I think we talked about this on a previous episode, just the way they were able to distribute the AI findings across 20 hospital systems across, I think 4 continents or something like that. And they were able to do it by sending the AI findings back to the cloud, but in a way where the data didn't have to leave the health system. And so that's just a powerful example, but they're doing this across hundreds of companies. And so when you think about the impact they're having in the AI space, and they're actually doing it in the radiology space, et cetera, I mean, patients are going to benefit so much from the Nvidia technology.
Interesting. That's still only 2. So you cheated, but you only did 2 categories and 3 companies. So you got to give me one more category. Give us one more category.
One more category. So, let's see what else is going to impact. I mean, analytics and AI are so impactful, but let's go with someone a little bit different. Well, I guess you said patients. I think healthcare organizations would be easier. I was going to go mention some legacy IT companies and stuff, but that doesn't quite work, I guess, in that way. So I guess if we're talking patients still, I would say, how about the direct-to-consumer companies and kind of primary care, direct-to-consumer.
Sure.
So one of those, I think that's, going to be really impactful. Oh man, I think I might take the Forward Health.
Okay.
I mean, that's a pretty bold prediction, and I need to get to know them better, but someone like that, I think is going to have that amazing impact. That's like, we want to transform the way primary care is provided rather than just, profit from the existing system. So I'll throw Forward Health in there.
Forward Health in there. Very good. Very good. I like those. Those are good choices, John. It's tough. I mean, because when we restricted just the patient experience, that's a pretty hard one. But I like it. I like the first thing you mentioned about the patient intake and the digital front door, because even though we might see a decline in telehealth funding, I think the digital front door is definitely got the boost now where people go, yep, I need to invest in this now. I think
Mhm.
people see the need for that, especially with the number of forms that we have to fill out online, and just getting people to the right facility, and
Mhm.
all that kind of stuff, which is all related to the front door. I think is
Yeah.
definitely good.
I wish I could have said interoperability, because I mean, I just see how many patients are suffering from the lack of interoperability. But I just think that our system is so separated
Mm,
that, there's some interoperability. The technology's there, right? They're doing great work, but there's just so many fiefdoms that, like, unfortunately, the technology is going to have a bit of a muted impact for the patients.
right,
So,
right. Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hahn. Today, we're surprising each other with 4 random questions about health IT. And truly, we're being surprised.
off the cuff,
It
baby.
is totally off the cuff. It's totally off the cuff. Okay. So, kind of again, related to the last question I just asked you
Okay.
around what 3 companies are going to really hit it big next year. Let's do the opposite. What are some of the things in health IT that you feel are completely overrated?
Oh man, overrated
Not
company.
companies, but just what
Technologies.
technologies and
Okay.
what's overrated in health IT.
Well, I think what's really interesting is that, if you're willing to pay money for it, like,
Mhm.
that's such a high bar, right? Like,
Okay,
people don't part with their money that easily.
sure.
And so I think, and I think most of them are pretty grounded. So that makes for a hard question. I probably would have said Watson Health, but does that even exist anymore? Which I guess illustrates it, right?
Yeah, but I think what you're talking about is the application of AI in to diagnosis. I think that's still a bit overhyped. I totally
Yeah,
agree with you.
exactly. That, yeah. So I think that idea, right, that the AI is going to replace the doctor, just not going to happen. It's
Mm,
going to augment it. Yeah, great, exactly. And so I think that's one example that I think is just really powerful, as far as, like, it's overhyped.
right.
We want to get there,
Sure.
right? I think of the Suki founder, when he was talking to
Mm,
him, and he talked about, even the future of ambient clinical voice, and his view was ambient clinical voice will never become a reality in the sense of totally AI driven.
mm,
It works fine with the back end, essentially, transcriptionists,
right.
that are doing the work. He's like, but if we were to build ambient clinical voice to its full capacity, he's like, we're essentially creating a doctor,
Mm,
which is what, the promise was of many of the AI, and many people thought the promise was. So I think that's really interesting to think about. It's like, and is that possible? Hopefully in our lifetimes, I'd love for that to be possible, right?
okay.
But in the immediate future, that's a long way. On my deathbed, I think we might be seeing it, and I'll be like, hey, oh, you just diagnosed me, great. So I'd say that's one that,
Is overrated. I like it.
yeah,
I think I agree with you.
yeah,
Totally agree.
yeah, definitely. A second category that's a bit overrated is, yeah, it's so tough to think through, but I think, I go back to, what do the CIOs really want,
Hmm.
right? And what's on their strategic vision? And I think there's a number of technologies that just don't make it there.
Okay.
And I think one, for example, is the symptom checker.
Ah, okay.
The symptom checker on the website.
Right.
Unfortunately, it goes counter to the business models of today. And so, we all look at it and say, oh, that seems cool, right? And that should help, and that will reduce urgent care visits, or, ED visits. And then the doctor's like, wait, or the healthcare organization's like, no, we actually need those visits. So unfortunately, I think that one's probably not going to have the success. Maybe they'll go hit the employer space
Right.
because they're paying for it. But yeah, I think that one's a bit of a tough challenge. And then I'll just throw in the trying to AI everything.
Okay.
Like, there's a few things that don't need AI, right? Like, do I really need AI to monitor my scrub distribution? I don't know,
Right.
right? Like, maybe that's a little overkill, right? Like,
Right.
I mean, and so, and I'm using AI in a really broad way, right? I mean, it's kind of machine learning
Right.
analytics, but so I guess maybe just those edge use cases of AI, that's like, did we really need it there? Like, I don't know. That seems like a a bit of a misuse of, or an overuse of the technology.
Cool.
Yeah. All right. So here's your third question.
Oh man. All right.
So think back on your career,
Oh
and
gosh.
let's imagine you had a time machine. I mean, you are the sci-fi nerd, so you understand time machines. And if you could change one thing about the trajectory of your career, what would you change?
Oh, wow. What would I have changed about the trajectory of my career?
Yeah, and it could be, that maybe the choice of company you worked at, or it could be the,
Oh,
place you went. I mean, you obviously started as a programmer. Many people don't know, and you became a marketer.
yeah, through sales, through the sales thing.
Yeah, I mean, you were traveling 365
Yeah.
days a year. I think
Y-
there's not even that many days in a year, but
Yeah, it's funny. That's an interesting question. I've thought about that sometimes. Like, would I have changed anything? Of course, you would say the right answer is I wouldn't change anything, because I probably wouldn't be the person I am today if I
Sure.
hadn't gone through those experiences, the good and the bad.
You wouldn't be working with me.
Yeah, I wouldn't be working with you, right? That's true. That's true.
Maybe.
Yeah, so I definitely have enjoyed. I've been pretty lucky in my career. I've worked with amazing people, amazing teams, and maybe part of amazing cultures. So I feel like I'm spoiled. So
Yeah.
definitely I wouldn't change
Okay.
that part.
Is there a skill that you would have?
But yeah, I was gonna say, so I think along the way, if I would change anything about my career, this is gonna sound corny. I would change two things. One, I think I would have changed my career much earlier into healthcare, because I got into healthcare kind of late. Like, it took me about 6-7 years of working before I really got into healthcare. And I think if I had found that sooner, I think I would have been a lot happier than, because when I was working with the banks, no offense to the bankers out there, they were pretty boring. and like what we were doing was kind of like, yeah, I'm really helping people figure out their mortgages a little bit better, but it was really not fulfilling.
Yeah.
So I was missing that in the first part of my career. So that would be one thing I would say is definitely I would have gone into healthcare a little bit earlier. The second thing I would say is I would definitely change how much I worked, because I like I'm workaholic, as you know. I'm up late all the time. I think I would go back and change, like, hey, like, you know what? It's 7 o'clock at night. You can turn the computer off. Like, you can go and do other things and things like that. I think that's probably the other thing I would change.
Yeah. No, that is life's such a tough balance, right? When you look at it. But what's interesting, especially in healthcare, and in my case, my hobby became my job.
Right.
Because I used to turn off my work and then do my hobby, which was, blogging at the time.
Right.
So, and now my life is
in the media company,
right? So it's like, so, I mean, that was always hard for me because, normally you have, we're about to hit the holiday season. Right. I guess as they listen to it, they'll hear it after the holiday season. But it's like during the holiday season, what do you do?
Right.
Well, usually you do your hobbies, right? Well, when your hobby is your job, like saying don't do your job is kind of like punishment, not. So it's just a funny balance, this life, huh?
It is. And it's true. Like, now that I'm in healthcare, I love what I do, everything I do. So it is hard to turn it off, because like, oh, I'm having so much fun doing this stuff. But yeah, I probably, in the early part of my career, I probably would have, when I was developing, when I was doing some other things, I would go back and tell myself, you know what? Turn that thing off.
Yeah. Well, you get into a zone when you're programming.
That's right. That's right. You get in a zone. Here's my last question for you, John. You go to a lot of conferences and you talk a lot on this podcast and other ones about some of the things we love about going to conferences. What are some of the things you don't like about conferences?
Oh, I don't like sitting in a plane.
Okay.
I like going places. I don't like traveling. But that part aside, I think the thing I hate most about conferences is the superlatives that I hear over and over, right? I mean, call it buzzwords, call it whatever. And oh yeah, even more than that is the crappy question. You're like, did you just ask something that we all know the answer to? And maybe I'm slightly biased because I go to too many events and conferences. And so, like maybe there's others in the room and I'm not their target audience, and that's fair. But like, oh, you hear some of it and you're like, that was the worst question ever. Like I can't handle those. Like I basically just hop on my computer. Thankfully for phones and Wi-Fi, we can do something else when it's boring like that. But like I just cannot handle that. And then I really don't like events that don't have a good social engagement. So whether and now that could be some engagement on Twitter, but doesn't necessarily have to be, right? But that can obviously prompt some of the in-person social engagement. I mean, I don't know how many times I've been tweeting and the person next to me like holds up their phone and shows it to me, and like my picture's there from my Twitter profile. They're like, "That's you, huh?"
I love that. I love that.
It doesn't happen as much anymore, which is interesting too. But but yeah, when it's really just go to the session, go get some food. No one wants to talk at meals, and you're like, it's like awkward because they're just not talking. Like anyway, I love the engagement and the opportunity to learn about that person in that organization. And so when it's really kind of focused around the education, which may work for some conferences, especially if you have CMEs and things like that. But for me, I want to have as many chances to have fun, to connect. I mean, and people think, oh, you want to go have fun, and my kids say, oh, Dad, you're going to have fun, which it's like true, yeah, I'm going to have fun, but I love that piece of the work.
Oh, that's cool. I thought you would have said the food. I hate the food at conferences. No offense to most conferences, but like those exhibit halls, it's not their fault, but exhibit hall food is terrible.
Yeah, I don't mind it so much as long as it's not the box lunch. If it's the box lunch, then I would say the food. They never work for me.
What's your last question for me, John?
Yeah. So the last one for you is, I hit conferences as well. Little HitMic shout out here, but what's the best health IT conference experience that you've ever had? And not necessarily conference itself, but like individual, like, maybe it was an evening event, or maybe it was a keynote, or was a breakout session or exhibit hall experience. What's the thing that's best that you ever saw, and why was it so good?
Oh, geez. So I first have to say, of the type of conferences I go to, my favorite is got to be user groups. So I love user group conferences because there's something about everyone having that right away, that one extra common element. It
does,
right? Like, hey, you're all users of this product. You're all in healthcare. Like, it's just, people tend to be much more engaging with each other. There's this sort of energy there, and usually companies go a little all out, right?
Yeah,
the experience is really good. So I love those ones. I think that's really a good experience. But I have to say, and this is going to sound corny again, my first HitMic conference was probably my favorite experience, because as with anyone who ever goes for the first time, which, by the way, if you've never gone, you got to go to HitMic, right? So go to hitmic.com and look at the conferences. But
hashtag shameless plug.
That shameless plug. And this was not planned, by the way, not planned. But it's what everyone says when you first go to a HitMic conference. It was like, you realize that you're not alone in what you're doing, and the challenges that we face as healthcare marketers in IT are faced by everyone else. And so it was just really amazing to be around other people who are either going through the same challenge or have been through it, and who totally understand like the jargon problems and the working with sales and the long sales cycles. And before going to that conference, I really hadn't had that many peers, if you will. And so what was really amazing about that conference, that first experience, was just being able to connect with people who were just like me. And so that was amazing. That feeling is not one that I've been able to replicate too many times. Just that whole camaraderie and the peer and the learning. And anyway, that's the one I would say.
That's a good one. I would say, for me, it was, I think, my third or fourth HIMSS. I was sitting there. It was at the end of the exhibit hall, and I was waiting to go to a party or meeting someone. I can't remember. And I was sitting in the hallway, just, on my phone doing stuff. And as I was sitting there, like 4 or 5 people came by, like, hey, John. And, we gave a hug, and, back when we could have hugs. And, I remember thinking, wow, this experience is so good to see so many people that I know, that I care about, that I was able to catch up with. It's like, it was like I almost found that rhythm of like, oh, okay, now this is my home,
Right.
right? Like this is where I'm supposed to be, and connecting with those people was so powerful. So that would be mine.
Yeah, that was in my head too. Those the first hymns, just being walking to the exhibit hall for the first time and realizing, oh my gosh, there's like 1,000 vendors in here, and that's
Yeah.
awesome. Like,
Yeah, for sure. I mean, the Meet the Bloggers panel at the first hymns,
oh yeah, I remember that.
and where I announced like, they said, "Oh, how many of you are full time?" Like they didn't believe blogs could actually be full time, and no one else did either. And I said, "Well, when I get back from this, I'm quitting the job in full time media." And they're like, "Wow," like, but media, being there with the other people who'd done, we were just grinding in our free time at
Yeah.
the time. So yeah, it's amazing how far it's come.
Yeah, those experiences are great. Hey, listen, thanks to all of you who listened and tuned into this episode of Healthcare IT Today. You can find out more details about our show by checking out the programs page at healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on Twitter using the hashtag HITSM. I'm Colin Hung, along with my friend and Health IT collaborator, John Lind. Thanks for listening, and have a great week.